What are the signs and symptoms of follicular lymphoma?
So again, most of times patients are non-symptomatic, and the way we realize that they have lymphoma is accidentally. If they do get to the point where they have symptoms, some of them may have what we call constitutional symptoms. So constitutional symptoms are typically represented by fever, unintentional weight loss, more than 20% of their or 10% of their baseline weight in less than 6 months, and night sweats, drenching night sweats. Usually full body night sweats as opposed to more upper body that tend to be more hormonal. Also, based on the location of the lymphoma and the organ that they may be pushing on, there may be completely different symptoms. So some patient may present with unexplained cough or shortness of breath or abdominal pain. Those are, of course, more non-specific and hard to correlate to their lymphoma, but could really be any symptom. But again, what I want to emphasize is that most of patients get to the point where they have symptoms really late in the course of their disease.
Yeah, the symptoms we think about can be lots of things. I think the most common thing that I see as a lymphoma doctor in terms of reviewing a patient's history of the early diagnosis is generally enlarged lymph nodes, because it tends to be a disease of the lymph nodes. I think other things that come up is also these B symptoms. So patients know something's not right because they're having intense night sweats, other symptoms. Some patients can also have low blood counts. So follicular lymphoma, not uncommonly, will involve the blood or the bone marrow or the spleen. And so those things kind of crowd out the normal blood and bone marrow factories in the body. And so sometimes we'll see patients that come in and someone realizes their spleen is enlarged, or they have low blood counts and they get a bone marrow biopsy test and we see follicular lymphoma. Because follicular lymphoma is also such a often slow growing illness, I see many patients that are actually diagnosed because they come in for something else. Say you get a scan for a kidney stone and then we see lymph nodes. And I've even seen patients that, have multiple scans and, had enlarged lymph nodes and probably had these lymphomas with no symptoms for years and years at a time. And that's another reason we kind of figure out how quickly things are growing and what the burden of lymph nodes is, because many of those patients clearly don't need any treatment, often for many years at a time.